Hi, my name is Amber Martins. I'm going to be doing the skill for CVC dressing change. I have my patient here, I have all my supplies and everything. First thing that I would do is check to see the doctor's orders to make sure that I was okay to do this skill. I would check the online charting to see if it was time to do the dressing change. I'd come in, I'd provide privacy for my patient, put the bed at a working level, identify my patient by asking him what his name is and checking to make sure that he could repeat his name back to me. I would explain to him what I'm doing, and then I would also check to make sure the date on his dressing to see if it was actually due to be changed, which it is. Before I started to do anything, I would just first take a look at the site and see if there was any redness or any swelling. See if the dressing is clean and dry or if there's any drainage that's seeping through. I would also check to see if the patient was experiencing any pain when I was palpating it and make sure that he wasn't. See if there's any warmth or anything like that. I want to make note of that to see if I should chart it later. And I'm going to come over here and I'm going to open up my supplies. Then I would wash my hands. I have a mask here, but I'm not going to wear it because it'll probably be more difficult for you to hear me if I do wear it. I also have another mask here for my patient. If they couldn't turn their head, then I would put the mask on and that would probably help. Before I put my gloves on, and I was careful to make sure that I went around the site instead of not going over on my sterile field and not turning my back on my sterile field. I'm going to loosen up the tegaderm before I I'm going to loosen it towards the insertion site. Just like that. Now that I've got it loosened, I would use a little bit of Purell, hand sanitizer, get my clean gloves on, and then going to just remove the dressing. Not quite loosening enough. And be careful to kind of keep it away from the, oh, my tape is stuck on tape here. That's his skin, just so you know. That's his IV site, not part of the dressing. I would keep this away from the patient so that I could look at it and they wouldn't have to see, and I would check to see if there was drainage on it, what the type, the amount, and the color was of that before I threw it away. And then I would just look at the site again. There's a little bit of redness here. I would see if he was having any pain. See if they're just checking the skin integrity, because I know sometimes that can be impaired because of the dressing itself. Take my gloves off, and I would actually just take the dressing and put them into my gloves and throw them away like that. Put some Purell on. I'm now going to do my sterile gloves, so I'm just going to put my stuff over here. highlight. These are such a pain. Okay, good. Get rid of that. Move this over, keeping my hands above waist level. And get my ChloraPrep, being sure to not break it towards the patient or towards me. I would just break it away like this. Now, I don't want to actually put this on his skin because I don't know if anything actually comes out. But anyway, then I would come over here to my patient. And I would go, I want to do it in a box motion around, and friction activates the ChloraPrep, so I would make sure that I'm causing friction. Huh?
Is that really on the skin?
No, it's just on the tape. Then I'm going to contaminate my pinky. I'm going to lift this up and go under there. That looks good. Alright, I'm going to throw that away. I'm going to grab my 2x2. Put that on. If there was tape there, I would remove it then. I'm going to grab my Tegaderm. I'm going to get my little notchy thing there. And now the sterile part of it is over.
Amber, 1 minute, 10 seconds left.
Okay, so then I would remove this. There's tape on here. I would purell my hands, I would take my tape off, I would write the date and the time of the tape, or the procedure on the tape, and I would put that on there. Then I would make sure that my patient was comfortable. I have a piece of tape here that I'd put to hold that in place. I would make sure if the ports needed to be changed or not. Then I would need to make sure that my patient is comfortable, has his call light, is all good, all that, and I would do my standard post-steps. I wash my hands. I would chart my procedure, I chart the date, the time, what I actually did, if there was any drainage, any site complications or anything like that, and how the patient tolerated it, and all of that. And that would complete my skill.